Welcome to Diseases with Dr. Deer. Today we're going to be talking about canine parvovirus. Canine parvovirus is a highly contagious virus that affects unvaccinated or undervaccinated dogs. Parvo is most commonly seen in puppies. Certain breeds appear to have an increased risk. There was an old-time saying that black and tan dogs tend to not do as well, and we see that with breeds like Rottweilers, Doberman Pinschers, German Shepherds, and Pit Bulls. Any breed of puppy can become infected by this. Puppies are afforded some protection in their first few weeks of life due to maternal antibodies. These are given to the puppy through colostrum of mothers with antibodies and slowly wean over 6 to 8 weeks. Infection occurs via the fecal-oral route. An infected dog will shed the virus in their feces. The virus then replicates in the oropharynx and then disseminates and leads to clinical signs within 2 to 14 days of infection, though we generally see signs within 5 to 7 days. Clinical signs include vomiting, diarrhea, fever, anorexia, and lethargy. They can have profound dehydration and they can develop hematochezia or bloody diarrhea. As the disease progresses, it can affect their immune system, leading to low white blood cell counts and bone marrow suppression. Diagnosis is generally made with an in-house SNAP test, though other tests exist. Patients that are very ill or very early in the disease may have false negatives and test positive through send-out tests that your vet may recommend. Treatment is mostly supportive care, though there is a new treatment for canine parvovirus called canine parvoviral monoclonal antibody, or CPMA. In the preliminary study, all puppies treated with only CPMA survived, whereas 50% of the untreated puppies did not. There are limitations to this study, but overall, this is very optimistic for future treatments of parvo. Otherwise, most parvo treatment is symptomatic and supportive. These patients are given anti-nausea medications to help with vomiting, antibiotics to prevent secondary infections or to help with bacterial translocation, fluids, feeding tubes, and electrolyte support. Prognosis is variable and based on the immune system of the puppy and their response to care. With hospitalization, it's estimated that 70 to 90% of dogs survive, and without hospitalization, the prognosis is closer to like 50%. Possible complications from parvovirus include intussusception, which is a telescoping of the intestines and requires emergency surgery. Thankfully, there isn't compelling evidence of there being long-term GI issues secondary to parvo. An appropriate vaccination and boostering schedule can help prevent parvo. Most puppies are started at 6 to 8 weeks of age, with a booster every 3 to 4 weeks. Depending on your location, the final puppy series will take place between 16 to 20 weeks of age. This is then boosted 1 year later and then every 3 years. Because parvo is so hardy in the environment, care should be taken when socializing young puppies. Avoid parks or fields and stick to places that have known biocontrol methods. Talk to your veterinarian about an appropriate vaccine schedule for your dog. If you're concerned that your puppy is sick, seek immediate veterinary care.